orgasm is a feeling. You know, when it does not need sperm to come out. It's when the semen is coming out, that's when you orgasm.
And how does it work in women?
Orgasm?
No.
No, sorry. Sorry about that.
No, it's absolutely. I mean, in terms of the vasectomy.
Vasectomy.
दो बच्चे होंगे तो then you know साथ में बड़े हो जाते हैं and all that. What is your take as a doctor on that?
I personally have 2 kids.
Yeah, I know.
My wife just gave birth on 11th of October.
Right. You said that as we are adopting more of the Western life, then is it like that that with infertility, are you also seeing that काफी सारे जो young, I won't say parents, young couples जो हैं, are they also not looking to have children as well?
You know, I will be very honest in telling you, out of 10 couples that come to our OPD, 3 to 4 of them are not having regular sexual intercourse.
Hi, and welcome to another episode of Expert Talk with me, Bhavya Desai. आज की कॉन्वर्सेशन में वी हैव स्पोकन टू डॉक्टर आनंद नानावती, जो एक्चुअली एक फर्टिलिटी एक्सपर्ट है एंड ही इज डन हिज एजुकेशन इन द यूके. बहुत ही इंटरेस्टिंग टॉपिक है बिकॉज more and more young couples, they are starting a trend in India where they tend to now get married a little later, and because late marriage के वजह से काफ़ी सारे fertility issues होते हैं in terms of getting pregnant. So वो सब के काफ़ी सारे हमने आज myths जो है वो डिस्कस किए हैं, उसका प्रोसेस क्या होता है, क्या ट्रीटमेंट्स आप ले सकते हैं, क्यों ये प्रॉब्लम्स अकर होते हैं, एंड ऑल ऑफ दोज थिंग्स आर इन दिस कॉन्वर्सेशन. ऑल्सो काफ़ी इम्पॉर्टेंटली हमने बहुत सारे डिबंक किए हैं मिथ्स या जनरल मिथ्स जो हमें दिमाग में आता है, वेदर इट कम्स टू विमेन, वेदर इट कम्स टू मेन, छोटी छोटी चीज़ें. सो इन्फॉर्मेटिव और इंटरेस्टिंग कॉन्वर्सेशन है. ऑफ कोर्स एज यूजुअल, अगर आपको हमारा काम अच्छा लगता है, आपने हमारे काफ़ी सारे दूसरे वीडियोज़ भी देखे हैं, देन प्लीज़ बिना सब्सक्राइब किए मत जाइएगा, बिकॉज आपका छोटा सा एक सब्सक्रिप्शन बटन ऑन करने का हमें काफ़ी बड़ा मोटिवेशन देता है टू ब्रिंग यू even greater content and make this enjoyable. Bell notifications भी ऑन कर दीजिए. हमें Instagram पे भी आप फॉलो कर सकते हैं, ऑफ कोर्स एक्सपर्ट टॉक पे, एंड ऑडियो प्लेटफॉर्म्स जो है वो भी यहाँ पे नीचे हाईलाइट हो जाएंगे. तो ये ऑडियो पॉडकास्ट भी अगर आप चाहें तो वो भी सुन सकते हैं. एंड एज यूजुअल, सी यू इन द नेक्स्ट वन. So hi Dr. Anand.
Hi Bhavya.
And welcome to Expert Talk with Bhavya Desai.
Thank you for having me.
Very excited to have you because जो टॉपिक आज हम डिस्कस करने वाले हैं वो काफ़ी इम्पोर्टेंट टॉपिक है, एंड आई थिंक वो ऐसा भी एक टॉपिक है जिसके बारे में काफ़ी सारे लोगों को आई थिंक पता भी होना चाहिए. So firstly, of course, welcome once again. If you want to say something, then please, and then.
No, Bhavya, thank you so much. It's an honor, to speak in front of, this wide audience with social media. Now a message gets carried over a long distance, and hopefully, whatever we discuss benefits, people all around India, and hopefully Bombay and India, hopefully.
Right. Yeah. Great. So, डिस्कशन के हिसाब से मतलब व्हाट आई वाज थिंकिंग इज दैट ऑफ कोर्स आई वांटेड टू टॉक अबाउट फर्टिलिटी. नेचुरली ऑफ कोर्स दैट्स अ वेरी इंपॉर्टेंट टॉपिक, बट उसके साथ में आई आल्सो वांटेड टू टॉक अबाउट गायनेकोलॉजी, इन टर्म्स ऑफ इन जनरल व्हाट हैपेंस एंड व्हाट डज नॉट, एंड नैरेटिव के हिसाब से देन आई वांटेड टू काइंड ऑफ ब्रेक इट डाउन मेन एंड वुमेन, बिकॉज मुझे लगता है कि the human brain, especially in men and women, function very differently. And especially in this topic, so I want to kind of address some of the myths also जो होते हैं usually people के mind में, and they might be as bare basics as it gets. Because I think if we are able to clear out those doubts as well in people's mind, so then I think the conversation will also be, I think, very great and in terms of content. So first up, is infertility in India, मतलब ये इंक्रीजिंग प्रॉब्लम है आज के तारीख में इंडिया में?
जी बिल्कुल. as we are getting more westernized, things are moving at a fast pace. The young generation are most of them are working, They want to focus on their careers. So late marriages are happening, lifestyle changes, environmental changes, all are affecting the reproductive health and in general the fertility health of the males and females.
Right.
So it is increasing. By the time they're ready to have babies, it's either too late. The bodies are already affected by various changes, habits like smoking, drinking, bad diet, bad sleep patterns, stress at work, stress at home. So the chances of them coming to your clinic, which was lesser about 15-20 years ago, are now higher. They need some form of help.
Right.
Yeah, to get
but
pregnant.
you said that as we are adopting more of the Western life, then is it like that with infertility, are you also seeing कि काफी सारे जो young, I won't say parents, young couples जो हैं, are they also not looking to have children as well?
Yes, you are right. So I would say out of 10 couples, just mere hi, close friends and, many of them, out of 10, I would say 3 to 4 don't want children. And that's almost 30-40%. Contrary to the previous thoughts, that okay, let's get married, let's have children, let's form a family. So there are quite a few couples who have, opted for not wanting children also. But majority of them are still looking for, having at least one child. Most of them are, wanting one child at least. So yeah, but yes, and as the generations will pass, I think this will be the new norm, that probably couples don't want to have children.
Right.
They want to enjoy their work, they want to enjoy their free time with each other. There have been some couples who opt for adoption also. And I think that's a very good cause.
It's a noble cause, yeah.
It's a very noble cause. I have told a few couples who have, got so many failed IVFs, they've done so much. And then they're willing to go to such lengths that, oh, doctor, can we take someone else's egg? Can we take someone else's sperm? Mix the two, and then I want to carry the baby. And then I'm thinking that you can, it's every patient's, right to want to carry the baby. But that wo genetically aapse to connected hi nahi hai. Why don't you think about adoption? There are so many orphans that are there, children who are abandoned in India. You're doing such a noble work, giving them a house, giving them a roof, giving them, a life. So adoption.
This is very interesting actually, because I also know of a few friends who've also considered adopting. And these are also people actually जो लोग अभी तक probably like they didn't want to, या उनको अभी तक कोई मिला नहीं है preferred जो partner जैसा उनको चाहिए था. And they've reached that stage कि हाँ ठीक है अभी now obviously I would like to fulfill that aspect of my life. To Celia, I would also love to do adoption, and not necessarily that they are married or they are with someone. To just like to adopt as a single parent. And that is brave. I mean, that's really brave. Right. ये काफी interesting आपने एक बात बोली कि if an individual is carrying a baby, which is where you have the donor, sperm as well as an egg from somebody else, and you are carrying the baby. So even if you carry that baby, then in general sense that DNA जो बोलते हैं हम वो कभी match नहीं होगा. That DNA will be completely separate.
Correct. वो बिल्कुल आपसे मैच नहीं होगा, बिकॉज जो एग और स्पर्म का जो डीएनए है वो डीएनए वो डोनर पेरेंट का ही होगा. सो डोनर द मदर एंड द डोनर द फादर whoever has donated the egg and the sperm, उनका ही डीएनए होता है. So it will not be biologically related to you. But carrying the baby gives a sense of, that, you're harboring a life, you're bringing the life, into this world. So एक connection तो बन ही जाता है.
Right.
So
but
that is,
ऐसे cases होते हैं काफी?
Yes, होते हैं. I would say about 1 out of 15 to 20 IVF cycles where we may require a donor egg and a donor sperm. And the patient or the woman wants to carry the baby. So it's a little rare, but होते हैं.
Got your point. Okay. Now, in terms of age, right? As you said that also काफी सारे लोग काफी late शादियां कर रहे हैं, तो naturally शादी late होगी तो obviously they would like to enjoy their life as well with their partners.
Correct.
Before they move on to the next this thing. How does age affect the fertility for both men and women?
Yeah, correct. So when you talk about men and women, as we age, the sperms and the eggs go through wear and tear.
Right.
Okay, more for the women than the men. So the best reproductive age group for a woman to kind of think about conceiving or having a baby is between 21 to 22 to 26.
Oh.
That young. Okay, because the egg reserve, जो अंडे की जो reserve होती है, it is at its optimal number during that age. In fact, if I go a little deeper, women are born with limited stock of eggs.
Yes.
So when a woman is a fetus, जब वो उनकी mother के पेट में is still in the fetus, 2 महीने की baby होती है, that time the ovaries are already formed, and their ovaries that time have 10 million eggs. When that fetus grows from 2 months to 9 months, still अभी तक delivery भी नहीं हुई है, she's not even come out in the world, the 10 million eggs go down to 1 million.
Oh.
फिर डिलीवरी होती है, the woman is out, the baby is out in this world, she grows up to be an adolescent, 12-13 years के एज में जब उनके वो महीना आना चालू हो जाता है, menses आना चालू होता है, then the 1 million eggs that were there go down to 1 lakh. So only 1 lakh eggs, around 100,000 eggs are available. And out of those 100,000, only 400 to 600 eggs will ovulate into the entire lifetime.
Wow.
After that, so the rate, the eggs don't multiply. The reserve is fixed, and the rate at which it declines. It depends on age. So, the older you get, the rate of decline in quantity, that is number, egg in matra, and quality of the eggs also go down. Also, genetics plays a role. अगर उनकी मम्मी को जल्दी मेनोपॉज आया होता है, like menopause age, menopause कब होता है? जब अंडे खत्म हो जाते हैं तब menopause बोलते हैं. Average age is around 45 to 50.
Okay.
If it is less than 40 years, then it's premature menopause. Then even she is at a risk of having menopause early. So you have to be mindful while asking the history also. Again, lifestyle factors like weight, diet, habits like smoking, drinking, recreational drugs, all of this is going to affect fertility. So as we age, the fertility potential goes down. And above the age of 35, it goes down drastically. Because again, not only the quantity, but the quality of the eggs go down. For males, it's a little more lenient because sperms multiply. But again, the new data, earlier, the data was suggesting from the Western world that till the age of 50, 50 to 55 also, males की sperm की health ठीक रहती है.
Okay.
But now new data suggests that after the age of 45, even male sperms get affected in terms of quality, wear and tear, quantity also may get affected. So as we age, the chances of the egg and the sperm being optimal in their health goes down. So
am I right to say then, you said that 21 to 26 is probably the ripe age where usually there are higher chances of women being fertile.
Yeah.
But normally, I think today's average age for most women to get married is to get pregnant or to expect a child is anywhere between 30 to 31.
Yes.
Is that correct?
Yeah.
So even if at that age, do they immediately should consult with their gynecologist, or it makes sense for them to try, or is it difficult after 26 or around that age?
No, there's nothing like that. So you should, if they've been trying for a year, of unprotected, not using any contraception, and the couple has been trying for a year, below the age of 35, and if they're not, getting pregnant, that's when they should go to a gynecologist.
So, but doctor, do you get to see that, or does this example also apply to couples who also have a big age gap? Because आजकल ये भी काफी commonly देखने मिलता है. Say for example, if the girl is 28, 29 or maybe 30 and the men or the boy is like beyond 40, then does that still apply?
Yes, it does, because sperm also plays a huge role in making of the embryo. And as I said, news data suggests that after the age of 45, the sperm health deteriorates. So the capacity for the sperm to form a healthy embryo also goes down. So you have to be mindful of that age gap also. You're absolutely right. It's a very good question. So if, let's say, the woman is 30 and the guy is like 45, there's no harm in reaching out to a doctor a little early. Please do a basic semen analysis.
Right.
Many of the couples, that come to us also have a big age gap, and some of the men are, working on ships, merchant navies. They're not there for 6 months, so they are quite, they already are aware that we don't have much time. So why don't you check our semen, and do you want to freeze it? Because whatever the semen that is I'm producing right now, if it's at good health, let us freeze it and keep it.
Right.
It's like an insurance, so that if we don't, if we are late and we're coming back after 6 months and all, but at least we can use these good quality sperms to help our partners get pregnant.
But in terms of women, say for example, now like how you said about like the men freezing sperms, so egg freezing is something which is also an important thing that is spoken about. But early age में egg freezing करना भी recommended है?
So again, the earlier you do it is always better, because you're giving good quality eggs. You need lesser hormones to kind of stimulate your ovaries or get going.
Right.
तो वो always better होता है कि एक थोड़ा जल्दी करो, but ऐसा hard and fast तो नहीं है. The woman also should be ready, that okay, fine, most of the time, women are not most of the new generation don't even know whether they want kids or not. As we slowly, they grow older and get a bit more mature, that's when they may start thinking that, okay, what, maybe at some point I might want a kid, but I'm not ready to settle down. Abhi mujhe settle down nahi hona hai.
Right.
But मुझे एक insurance चाहिए. I want to be independent. I don't want to people rush into marriages just because they think that, oh, time is ticking, and then they don't find the right partner. We've seen that. I see couples. So this has given this is a great opportunity for women. It's empowering women that, okay, you can think about freezing your eggs. Then whenever you find the right partner, you can still try naturally. And tab agar nahi hota hai, then you have these eggs that are, if you've frozen at 28 years of age, and let's say you find the right partner at 35, you've tried, pregnancy nahi hui hai. So when you come back and you have to do IVF using those eggs, वो eggs तो 28 years के ही है.
Right.
वो तभी freeze किए हमने time.
Nice.
So it is a great opportunity.
But what is the percentage of women who are actually utilizing such treatments today?
Egg freezing.
Yes.
It's getting more and more common. It's not. So I worked in UK and वहाँ पे ज़्यादा common था. वहाँ पे थोड़ा ज़्यादा awareness था. मगर यहाँ पे भी काफ़ी कॉमन हो रहा है. I would say every month we have around 1 or 2 young women, unmarried women, inquiring and even doing the cycles of egg freezing. अभी भी थोड़ा awareness की ज़रूर है, because there are a lot of myths and misconception around the whole process of IVF. Basically egg freezing के लिए भी IVF का ही एक procedure है.
Right.
तो बहुत ज़्यादा डर होता है कि मोस्ट कॉमन डर है कि IVF तो पेनफुल है ना, उसमें मेरा बॉडी चेंज हो जाता है, लॉन्ग टर्म कॉम्प्लिकेशंस है. सो ये सब मिथ्स है, सो वी ऑलवेज टेल देम दैट इंजेक्शंस जो है ये आपके ही हार्मोन्स है. It is just given at a slightly higher dose because we want maximum number of eggs what we can in that one cycle we remove and then we can store them. So ये आपके ही hormones है. It is just given at a supraphysiological level or in other terms ज़्यादा higher dose से लेते हैं. Yes, around 10 days, 12 days injections लेना पड़ता है. Temporarily थोड़े side effects आ सकते हैं. थोड़ा आपको थकान लगेगा, थोड़ा headache हो सकता है, mood swings, irritability, bloating temporarily हो सकती है, मगर after your eggs have been collected, and the procedure of egg collection also is not painful, it is done under anesthesia.
Right.
You will not feel pain. हाँ, अब आफ्टर प्रोसीजर, कोई भी प्रोसीजर के बाद थोड़ा वो सोरनेस हो सकता है, एक दिन का ब्रेक लेना पड़ता है वर्क से, बट इट्स फाइन, यू नो, नेक्स्ट डे यू आर फाइन, यू कैन डू योर डे टू डे एक्टिविटीज. सो ये जो थोड़े से डर है वो उस, आई थिंक दैट इज अ मेन बैरियर व्हिच इज प्रिवेंटिंग मोर women to or more girls opting for egg freezing.
Okay.
And other misconception is कि ये eggs freeze करेंगे तो खराब तो नहीं हो जाएगी क्वालिटी में. अभी की टेक्नोलॉजी इतनी एडवांस हो गई है कि you know, with good freezing technology, with good thawing, with good labs, survival of egg is good.
Right.
Not all of them may survive when we thaw.
Right.
That is also, we have to be very honest with the patient. So usually 90% of the eggs survive. You know,
so
with a
meaning
good
when you said earlier that by the age when you are ripe, I mean, ripe is such a funny word.
Yeah.
By the age when you are, you can bear a child, you can bring a life for a woman. So by that time, the egg count जो normally 1 million होता है वो lakhs में आने के बाद about 5 to 600 हो जाता है.
Yeah.
Out of which, so it's technically 1 out of 600.
It's not 5 to 600. It remains 100,000. Okay. But out of those 100,000, in the entire the rest of the reproductive lifespan, only 500 to 600 eggs will only ovulate.
Okay.
Otherwise, eggs होते हैं.
Right.
There's no exact number, but you have to just remember it is, it just keeps coming.
So जब भी egg freezing अगर ऐसे होती है, so what is the number of whatever percentage out of the actual eggs which get frozen?
Yeah.
Do we have an idea?
Yeah. So I think what you're trying to say is that what is the ideal number of eggs we should have to get a good chance, for the egg for her to get a successful pregnancy?
No. Like normally, when we do egg freezing, then is there like a quantity of eggs that actually get frozen?
Correct. Yeah. So an ideal number should be around between 10 to 15 eggs. Okay. 10 to 15 eggs is a good number. Because as I said, 85 to 90% will survive. So let's say you get 10 eggs. 9 eggs survive करेंगे. And out of those 9 eggs, usually supposing we are using these eggs for IVF, usually studies say that 30% of these eggs with a good sperm will form embryos. And we're talking about embryos which have reached day 5 state. Now, I'm not going to day 3, day 5. It's too much technicality. But 30% of them will give you an embryo. So, again, with that, it's age-wise. So, again, this is going a little deep. But when a woman comes at the age of 30, let's say they're doing IVF. At the age of 30, you have to understand that not all eggs are also going to be mature. Not all mature eggs will fertilize. Not all fertilized egg also give you an embryo. And जो बच्चे का बीज जो बोलते हैं उसको embryo बोलते हैं. Not all of those embryos also are going to give you pregnancy.
Got it.
So what are the number of embryos that we need to get us a good chance of having a healthy baby? That depends on age again. At the age of 30, you need around 2 to 3 embryos for one of them to give you a healthy live pregnancy.
Right.
To get 2 to 3 embryos, you need into 3 karo up 30% eggs bante embryo, so around 9 to 10 eggs. Okay. At the age of 35, you need 3 to 4 embryos. Up into 3 karo, so around 12 eggs agar bane milte hai to achhe hai. So you need more and more eggs as we grow older. Right. The requirement is a bit more. So on an average, 10 to 15 eggs is a good number.
Got your point.
Yeah.
Okay. But infertility is, so there is a very common myth or a understanding that people have, which I don't know, maybe I think you'll be able to clear it much easier, and it's very blatant and very open. Usually people feel case infertility is also because people are having less sex.
Yes.
Yeah. So is it like that? Are Indians having less sex?
I will be very honest in telling you, out of 10 couples that come to our OPD, 3 to 4 of them are not having regular sexual intercourse for whatever reason. There are conditions like erectile dysfunction that is becoming very common, again because of lifestyle, bad habits like smoking, obesity. Men are at a higher risk of getting diabetes, because of the diet choices that they are having, all of that. And all of these conditions are predisposing, or basically causing erectile dysfunction. So erectile dysfunction in males, there is a condition called vaginismus in females, which is also a very important topic that we should cover. It's actually very common. And what is vaginismus? It's an involuntary contraction of the vaginal muscle, where the female will just not, be comfortable. Intercourse becomes very difficult. And vaginismus is actually, there are many causes for vaginismus. It could be that it is actually the muscles surrounding the vagina are actually very taut or, tight or tense. But most of the cause of vaginismus is psychological. There is some form of psychological trauma or, something in the past that has happened, or something that they're going through, at present. So careful counseling, patiently hearing them, and being very sensitive. You have to be empathetic. Well, empathetic is difficult because for me, I'm a male, but you have to be sympathetic. These are things that prevent couples from actually having natural sexual intercourse. So if these are the cases, then you try and first resolve it. I had a couple who had an issue where the woman had severe vaginismus. She would not allow any examination. They've never had penetrative sexual intercourse. And they were visibly, disturbed because, you get depressed, you're trying to understand, and then no one is actually trying to give them answers. So we sent them to a psychologist. The psychologist somehow, took a few therapy sessions. Subconscious, there was a few past history of some, trauma. She got over that, but that doesn't mean that now suddenly she'll be fine, because she's never allowed. So then it's a process. Then there are, instruments that help them kind of get used to the feeling of intercourse. So there are these dilators that we have, and we tell the woman that you are empowered, you use them. Starting from less diameter, less size, and then whenever you're ready, you go up the order. A good 6 months went by, and then there was a long gap. They came after 5 years, and they were quite young. They were 31, 33. So they came after 1 year. They were just looking so happy, and they didn't conceive. They conceived later, but they were just happy that they were able to have sexual intercourse. Their bond, was stronger. Absolutely. So you have to address, because when they came to me the first time, they said, "Doctor, we have come to you for IVF directly." And everything was normal. And then I realized that, okay, fine, I can do IVF. No, it's good for me. But, what, let's go a little deeper. What is happening? You're not being able to have sexual intercourse. Do you want us to address that? And they said, yeah, because that is also important.
But are people open to stuff like this as well? मतलब क्या patients आजकल? I know the younger generation जो फिर भी आती होगी, they still might be a lot open, but then ये एक ऐसा topic है, whether it's infertility, whether it's sexual intercourse या कोई भी ऐसी चीजें, are couples open, or do they say, okay, I'll talk to you maybe separately when husband is not there, wife is not there?
Yeah, so couples as such are open. When they come with their mothers and mothers-in-law, they're not. So I have a rule that no mothers-in-law, nothing, no brother, sister, koi nahi. The couple has to come on their own, and so that they can tell whatever they want to. Because external factors, हमारे society, joint family होता ही है, everyone is meddling into everyone's business. Out. Sorry. Unless, so core consultation involves only the couple. फिर बाद में अगर आपके in-laws या mother को कुछ और father को कुछ questions है, फिर मिलूंगा. But first, when they're opening up, I don't want anyone.
Yeah, because I think there's a lot of stigma as well. Actually, also the situation is because the human body is so complicated.
Yeah.
And more importantly, I think when it comes to reproductive organs or especially fertility and all, I think ये इतना मतलब I think it's far more complicated than how like any of the other organs work as well.
Yeah.
So I think from that perspective, I can completely understand that there are so many traumas, there are so many stigmas, there are so many myths as well.
Yeah.
And it must be. But how do you, as a doctor, then how do you like see, because you are an individual as well, you're a human being as well.
Yeah.
How do you isolate yourself from a
From my
problem
work. Yeah.
that they have, and then from a
Yeah, very good question. Not a lot of people think about doctors because, to be honest, when you're day in day out, see, I keep telling my friends that infertility specialists are somehow a therapists only, because half the time the counseling goes into it's a kind of therapy. We're talking, we're addressing so many psychological factors, mental factors, physical factors to hote hi hai. So and also when the woman is going through the cycles of treatment, we are also very deeply involved, that suppose embryo transfer किया या procedure like IUI जहाँ पे हम जब अंडा निकलता है तभी husband के sperms लेते हैं, wash करते हैं, sperms को directly uterus में डाल देते हैं with the hope that they get pregnant, and then there's a waiting period, 15, 16, 17 days के बाद हम जो test करते हैं वो हम भी इतने impatient हो जाते हैं, and then when the result comes positive we are elated, if it doesn't come we also get dejected. So in the beginning when I started out, I used to also sway. जब when there was no result, I used to also go down, अरे यार क्यों नहीं हुआ, ये नहीं, मैंने कुछ बराबर नहीं किया या ऐसे. And when it used to go up, I used to be, oh wow, I'm like God, Then as we become mature, experienced, we kind of isolate, you have to kind of, when you're out of the office, you're out, because otherwise, then only you can function, then the next day you're again recharged and at your optimal best.
Right.
So, it is difficult because, sometimes we get too attached. But then we have to make sure that, it's during that time, fine, you address and you give in your 100%. Once you're out, at home and all, don't bring work at home.
Understand.
I used to do that and used to affect, my family life, somewhere we used to, because you also get frustrated sometimes.
Right.
But you have to detach.
Understand.
And that's
It's
important.
important
And
as
I
well,
tell the couples also कि जब भी कोई ट्रीटमेंट की होती है, आप रिजल्ट का इतना मत सोचो. रिजल्ट कई बार हमारे हाथ में नहीं होता है. आपका काम था, जो आपने बेस्ट किया है यहाँ तक पहुँचना, मेरा काम है मेरा बेस्ट करूँ. आपका भी काम है जो भी मेडिसिन दिए है डॉक्टर ने, आप लो and you take it one day at a time. Many people, the most of the reasons why people feel very dejected and low is because they're fixated on the result. And another common mistake is comparing themselves with others. ऑफिस में मेरी ये 2 colleagues को तो हो गया प्रेगनेंसी, इनको तो हो गया, पड़ोसी में किसी को हो गया. सबका बॉडी अलग होता है. योर बॉडी इज डिफरेंट, योर स्टोरी इज डिफरेंट, योर जेनेटिक मेकअप इज डिफरेंट. Don't keep comparing.
Yeah, I think that is an innate perception that is inculcated, I think, into Indians.
Yeah.
I feel because of
They're very nosy.
very competitive past.
Yeah.
I have a very different theory for it, but that's for a different day. I mean, I think the mota-moti factor of that is, why I feel because I think India, from being a very rich country, it went into slavery.
Yeah.
Became a really poor country by the time the British left. And after that, everything was basically a rat race.
Exactly. Rat race. I was just going to say that. And that survival of the fittest, which is, it is, but you don't have to, it's more in the animal kingdom.
Right.
We've still not got over that.
Yeah, because right since childhood, it is like a child comes out and he'll be like, better school, you study, get good marks, you'll go to a better college, you get to a better college, you'll have a better education life, better work, better outcome, better financials, better partner, so a better life.
Exactly.
Which is not, I think, the way most people are wired abroad.
Yeah.
Because there's a lot more about quality of life and stuff like this.
Yeah.
So that's a conversation for a different day.
Yeah.
How is infertility linked to PCOS and PCOD?
Yeah. So PCOD and PCOS is again a lifestyle condition. It has genetics. There is a genetic factor and an environmental factor which is at play here. So PCOD has also, we've seen a lot of it's becoming more common. About 15 to 20% of the patients suffer from PCOD. And what happens in PCOD is there is a particular hormone called LH hormones that is in your body, which is slightly higher than what it should be. What this causes, it causes a series of changes in the body. It causes the insulin levels also to be high. Insulin basically increases the fat deposition in the body, especially around the tummy area. So they usually are slightly heavier. And that fat converts, acts as a substrate to convert female hormone to male hormones. And then the male hormone is also slightly higher in these women.
Right.
And that affects the egg quality. Insulin itself affects the egg quality. A higher LH level also prevents the egg from getting released, So many, up to 60% of the patients with PCOD don't ovulate. They don't get regular periods. So if you don't ovulate, egg आता नहीं है तो आप pregnant नहीं हो पाओगे.
Zero है.
So infertility, out of the women needing infertility treatment, I would say around 40% of the patients in those who are coming to your infertility OPD suffer from PCOD. It's that common. So you have to again evaluate, what is going on. Most of the time, if they're not ovulating, side by side from fertility, address your lifestyle. Important to address lifestyle because that's your mainstay of the treatment. Right. If they're a little overweight, if their BMI is weight to height ratio is above 25, tell them to come within the normal BMI, which is 19 to 25. So diet is important. You don't want insulin to go high. So don't eat, carb rich, too many carbs. Don't eat too many chocolates, sweets. Okay. It's not like you have to do keto.
Right.
But my rule is after sunset, avoid carbs if you can. Daytime, since you're working, you're active, you take whatever carb intake you want a day. You can have a fruit, a chocolate a day, but during the daytime.
Right.
Because then you're working out, your muscles are working. Whatever sugar is getting produced, the muscles are going to take it in.
Yeah.
Okay.
Yeah. Also, there are good carbs and bad carbs.
Yeah,
as well,
good carbs and bad carbs are also there.
Right.
And so it's important to address diet. It's important to address exercise also. In exercise also, there's a common myth कि नहीं चलो खाली cardio ही करना है. नहीं. It's all three. Little bit of weight training, little bit of core, and cardio. It should be all three of them.
Right.
Okay. So this is important to address.
So is it true that would it be right to say कि जो fit लोग होते हैं, both men and women, they will possibly have it much easier to be successful and be pregnant?
Nothing in extreme is good. Huh? I have seen those extra fit people also not conceiving. Now I'll tell you a story. I had a couple who came in and the husband was ripped, the muscle built and everything. And they've been trying for quite a few, years, I think a couple of years. Did semen analysis and there was no sperm. And then on prodding, you realize that, okay, you're taking supplements, supplements with steroids, all of this affects. I told him that, stop, using these supplements. 3 to 6, I would say about 4 to 5 months later, we saw after stopping the supplements, we started getting, sperms in the semen. So that's where, extremes also should not be there, and even for women, those who work out a lot, this extreme form of working out, they also have period problems. So if you see there are athletes, those professional athletes, they have this term, they come where they don't get periods, and that's called amenorrhea. It's called athletes amenorrhea because their body has such high levels of cortisol, adrenaline, prolactin. These are hormones that increase with physical stress that will prevent the egg from forming and releasing, and again, when the egg does not release, you will not get your period. So then it causes infertility also, and they will not get period also.
Right.
So it affects. So no extreme of activity is not recommended. It should be a balance.
Understood.
3 to 4 times a week, 1 hour in the gym, or swimming, or exercise, yoga, whatever you enjoy is you enjoy, but don't do it.
Don't overdo anything.
Overdo it.
Yeah. You mentioned earlier about like some conditions, and also उसमें आपने थोड़ा सा diabetes भी use किया.
Yeah.
If a couple who's trying to get pregnant, and if either of them are diabetic, does it create complications for pregnancy?
Yes, it does. It's a very good question. If they are known to be diabetics, your first, and if let's say they are coming to you for trying for a baby, please check their sugars first, because you don't want a pregnancy in a state where the woman's sugar levels are very high. Okay, so there are certain cutoffs we take. Fasting blood sugar should not be more than 100. There's a term called HbA1c, which gives you the last 3 months का एक average, blood sugar का average क्या है. That should not be more than 6. Some people say 6 to 6.5 पे भी आप try कर सकते हैं. It should not, ideally it should be less than 6. Okay. If it is more than 8, 7.5 to 8, you should tell them first you control the sugars, because the chances, if you get pregnant, your chances of of miscarriages are higher, because in that environment the egg that has come out may not be healthy, the embryo may not be healthy, so miscarriages के risks होते हैं. Supposing early miscarriage नहीं हुआ, कभी-कभी babies अगर sugars control में नहीं रहते, so during the time of organ formation, some of the organs may get affected, heart problems होते हैं, spine के problems निकलते हैं. So babies may, abnormal babies may be formed, and sometimes the sugars are controlled, and some women, like let's say PCOD also, women with PCOD have a higher risk of diabetes. So in pregnancy में भी कभी-कभी diabetes के risks होते हैं.
Right.
So अगर बाद में भी, इसलिए हम regularly हर एक pregnancy में sugars check करते रहते हैं. And अगर control में नहीं होता है, then again those babies are at a risk of being larger in size. So then they, the chance of normal delivery is lesser. Chance of fetal distress is more. The chance of us delivering the baby early is a bit higher. So ये सब complications होते हैं. So sugar, diabetes should be checked from the beginning.
Got it. But say for example, अगर कोई एक patient है जिनको already diabetes है, say for example it's a female जिनको already diabetes है, and if obviously assuming that it is under control below the score of 6, what is the percentage of success in their case? The reason I'm saying is, and the reason I want to focus on diabetes, because मुझे ऐसा लगता है कि आजकल diabetes in young people is really rampant. I was looking at the numbers, and the percentages are also increasing quite a lot. And I'm sure a lot of them are women as well. And naturally somebody who wants to get pregnant, तो ये information मेरे हिसाब से उनके लिए बहुत ही critical हो जाती है.
Correct.
So in terms of that success as well, where do we stand? If it is under control, then out of 100%, what are we looking at?
So if the diabetes is well controlled, and if she is within the normal weight, BMI range, her success rate is as good as someone with the same ovarian reserve. We're talking about same age, same ovarian reserve compared to someone who does not have same age. So control of diabetes is very important. If it is not well under control, now another variation is if it is well controlled but she's still overweight, weight itself also plays an independent role in affecting fertility. So weight, diabetes, these are all separate factors that are causative for infertility. So you have to address all of that.
Got it.
So if she's within the normal range, well controlled, yes, despite medication, she has as good a chance of conceiving as someone who does not have diabetes with the same age and similar ovarian reserve.
Right.
So control में रखना is important.
Interesting.
Yeah.
ये मतलब in many ways मुझे ऐसा लगता है कि of course, like I think as Indians, normally we have a lot of myths about what is exactly happening. And I think fertility को लेके मेरे को लगता है pregnancy को लेके I think there are 100 millions of them.
Yeah.
So there were some which I actually wanted to address, and it is, I thought it would be great, I mean, especially for you, to clear those out for people once and for all. Like, is it true if they say, bolte hain ke if men's testicles usually are like warmer, and when you like wear tighter jeans, tighter underwears, XYZ, all of these things, then they do not perform enough sperm quantity. Is that true?
So, this is actually not a myth. It's a fact. So, the reason why in men's testicles and, male primates and male even animals, the testicles are outside the body is because sperm need a lower temperature for their production. So, being in a constantly hot environment does affect sperm quality. So, ऐसे नहीं कि tight underwear, अब 8 hours if you're wearing tight underwear, it's fine. But if you're working in, like, let's say a factory, like chimneys, someone who's a baker, close to the oven all the time, bike riders also, because that, I don't know what it's called, but next to the seat, that becomes hot.
Yeah.
That also affects sperm. So yes, temperature is important for sperm. But ऐसे नहीं है कि घर जाके then, some people say that, but then sir, मैं घर जाके ice में डालता हूँ and it will reverse. ऐसे भी नहीं है. But yes, it's important to be in a comfortable environment. If the underwear is too tight, it's kind of, you should be comfortable. It should not be too tight. If you happen to be in one of these professions where you can't escape, make sure to take breaks. Go out. Kind of, and when you're at home, try to kind of wear loose clothes. These are the few things that you have to, or if you are in a hot environment, then don't wear tight underwear. Wear boxers, wear something, comfortable. So that, testicles don't feel entrapped. So,
is extended use of, like, what do you call it, tablets and computers, by keeping them on your lap, is that recommended or not recommended for both men and women?
So again, more for men, there has been a lot of data that is coming out where if you keep the phones in your pocket, it's not the heat of the phone, because nowadays the phones are not, they don't get warm. They don't get warm, but it's the radiation, the calls, the messages. This is all radio frequency, and a few studies have shown that it does affect sperm quality. Again, it's the genetics also that is important. It won't affect everyone, but then don't take a chance. So probably try to keep your phone on your shirt pocket.
But they say that's also really bad because for
the breast and heart. I'm not aware of that, but there was a study that it may affect even males get breast cancer. There is breast tissue in males also. Yeah, very rare, but there is breast tissue in males also. It's very, very rare. But so they say avoid. But then now, where are you going to keep it? The best way would be just, so whenever you're sitting, during traveling, when you're traveling, you may have to keep it. But when you come to your office, make sure that you keep it aside, not close to your body.
Right.
And that's the majority of the time where you are, working or at home. Same with laptops. Laptops are on. Now, laptops get heated up because the battery is down. So try to avoid keeping it on your lap. Keep it on the chair. For the women, funny, you asked. I had a patient who had come from America. She's Caucasian American, married to an Indian. We did her embryo transfer. She was, she came to me for IVF. And then, I happened to, we always tell the do's and don'ts. And, this is one thing that I missed out, that it's not hard and fast because, uterus and all that is very deep. See, testes and all are superficial. They're exposed to the environment more than uterus. So there's no study as such that, keeping your laptops on that lap. But then she was like, doc, you didn't tell me, this affects this. And, and her result was the next day. And I said, look, calm down if you think, and, just keep it on the desk and, work. I've been working it, with it on my lap, and I was Googling and I said this. I said, okay, now you can't change, fine. she got a positive result. She in fact got a baby girl, last year only. So there are myths. People take it a bit too overboard also. But yes, for male, it's more important for males because anatomically the testes are outside the body. It's more exposed to the environment.
I understand.
More for males. Yes.
It's very interesting that you say this about someone who actually came in and prompted a question in my head. Medical tourism is a big industry.
Yeah.
Right, in general, and I think, do you see that in terms of fertility as well, where there are more and more people coming in for treatments? And I don't think it's only the cost. I think it's also because the treatments are far better here as well.
Yes, yes. So yes, we are seeing it very commonly, especially from Middle East, African countries, East African countries, Mauritius. We get a lot of patients from Mauritius because of the dearth of infertility specialists in that area. We have so many specialists, infertility specialists in Bombay only, and everyone is good. Affordability is also a very important factor. Cycles abroad. I have patients from Mauritius who have inquired in South Africa because that's another country which is close by.
Right.
And the cycles cost them at least 4 times more, 3 to 4 times more the cost than India. If you go to Western world, UK and all, private IVF cycles are anything between 20,000 to 25,000 pounds. 20,000 pounds, the whole cycle. Whereas over here is about 1.5 to 2 lakhs. So it's a significant,
big difference.
Lesser.
Right.
So we do get a lot of medical tourism, as you said, because of specialists being here, and our healthcare system is really good. Right from the government hospitals that are training, even the private hospitals that are training our young doctors. Right from there, we are lucky that we are having good teachers, and it's all inculcated. And our system is so rigorous, with so many numbers that you get experience very early because of the numbers. So a lot of people come to India for treatment.
Right.
And also waiting time. Waiting time in the Western world, there's a lot of waiting time. I have a couple right now in Canada who's getting their treatment. They can only accommodate them after a year. उतना टाइम नहीं होता है तो वो फिर बाद में इंडिया आ जाते हैं.
Right. Yeah. This is something that I've heard as well, because it's the treatments. Everything is taken care by the government over there, so there is a long waiting period. It's more about like when you get in. I understand. Coming to this another question, which is about this myth that came to my mind, is that normally it is believed that if you're trying to get pregnant, तो males को encourage किया जाता है कि do not masturbate every day. The reason is because
counts कम हो जाता है.
Right. Is that true?
No. See, I tell them actually कि सबको यही लगता है कि गैप ज्यादा रखो तो अच्छा होता है. नहीं, अगर आप 5-6 दिन की साइड भी ज्यादा स्पर्म्स अंदर रखते हो और फिर आप सीमेन एनालिसिस करते हो तो बहुत सारे स्पर्म्स इमोटाइल होते हैं, मोबिलिटी उसकी लो होती है, मोटिलिटी लो होती है, डेड स्पर्म्स होते हैं. सो इट इज नॉट ट्रू. Even if you have sex every day, concentration of sperms per ml does not change much. Okay, in fact, with a lesser abstinence, कम gap में the motility is better. Okay, the vitality of the sperms is better. खाली जो semen की volume होती है वो थोड़ी सी कम हो सकती है. The reason why we say it's not, doctors also say that you don't need to have sex every day because mechanical सा हो जाता है. People, let's say they've started trying from 10वां दिन है period का and you start trying every day. और अगर egg release होने वाला है 16th day को, by the time you reach around the time of ovulation, you may be tired. On that day, you may miss. And also, very important to tell the couples that sperms remain alive up to 2 to 3 days in the female reproductive tract.
I was actually going to ask that. Yeah.
So technically, you don't need to keep having sexual intercourse every day. Just, if you want to, that's fine. You can. You see, don't discourage anyone. ऐसे नहीं है कि नहीं होता है, but just for the sole purpose of having a baby, you have to have sex every day. ये एक है फैक्ट बोलना कि 3 दिन तक स्पर्म्स रह सकते हैं. So आप हर 2 दिन के भी गैप में रखोगे, you have a good chance in conceiving.
Understand. Right. You said that diet plays a very important role, which is natural. Are there any natural, how do I put it? Like, are there any natural ingredients or natural organic things that you can consume which increase fertility for both men and women?
Yes, absolutely. But see, nature has its bounty. Nature provides us with all the answers. So diet, green leafy vegetables, anything which has fiber, which has antioxidant properties, your vitamin C, vitamin B, minerals. So your green leafy vegetables, fruits like berries, they have good antioxidant properties, good for sperm and eggs. Avocados, they say, have good essential fats in them. So that is very healthy for both sperm and egg, because there are certain type of essential fats that are present in avocados. Salmon, fish, which is एक fish होती है, उसमें essential fat होता है. Mediterranean diet itself, they say, has, there was a good study. It's on ASRM, which is American Society. There's a study where they've seen that Mediterranean diet, those who consume that diet, fertility potential is better, because they are rich in yogurt, green leafy vegetable, berries, apricots. These are very healthy, with essential minerals and antioxidants, which keep the egg and health and sperm health intact for a longer time. Yeah.
These products, like what they actually advertise, like this Shilajit and all of these things. Shilajit, sorry. Yeah. Do they also increase?
They work. See, I don't have any direct literature for me to comment against or for it. I know it's a part of Ayurvedic treatment.
Right.
I feel that there is some, all of these sciences also have some basis, So Shilajit usually is given for those for potency, or
libido.
Right. Increase the libido. And anecdotal cases mein when I just ask, a lot of men say that yeah, isko lekar my family doctor or naturopath gave me and I feel like better. But that doesn't mean that it is translating to fertility. But I can't comment on it, because I don't want to offend my fellow Ayurvedic or homeopathic or whatever, this thing. It has worked in increasing the libido, that much I know, but I wouldn't, because it's not my field. I can't prescribe it, and I would not. If someone says that, sir, can I take it while I'm taking your treatment? I would say that I don't know anything about it. Preferably, if you're now taking allopathy, stick to allopathy, and I would stop it.
Understand.
Because there are no studies done, We don't have enough studies. See, whatever treatment we give is evidence-backed. Evidence comes from studies, many years. A lot of, people are within that study population. Then when the results are positive and reproducible, only then you can say that, okay, this drug will work. So now there are no studies. So I can only go by evidence-based medicine.
Right. Let's talk about like treatments a little bit.
Yeah.
Is there a difference between IVF and IUI?
Yeah.
Can you tell us what?
So IUI is a little lesser form of a lesser invasive treatment. Okay. So let's say a couple has tried naturally and they've not got pregnant. Or if a couple cannot keep relations, like erectile dysfunction, penetration problem है, then IUI is recommended. So IUI में क्या करते हैं हम basically जो lady होती है उनके second day of the period में से या third day से हम tablets देते हैं तो जो उनके अंडे की जो बीज होती है या अंडे को grow करने के लिए tablets देते हैं. फिर हम वो अंडे को ट्रैक करते हैं फॉलिकुलर स्कैन्स से. सो वी कीप ट्रैकिंग इट. और जब वो अंडे का बीज बड़ा मैच्योर हो जाता है, अराउंड 18 to 20 मिलीमीटर साइज का हो जाता है, दैट इज द साइज वेयर यूजुअली उसके अंदर का अंडा मैच्योर हो जाता है. फिर हम एक इंजेक्शन देते हैं, हम नेचुरली भी रख सकते हैं, बट इंजेक्शन से क्या होता है कि हमको टाइमिंग अच्छी से मिलती है। इंजेक्शन देते हैं, उसको ओव्यूलेशन करने में हेल्प करता है वो इंजेक्शन। वो इंजेक्शन के अराउंड 36 to 40 आवर्स के बाद हम यूजुअली ये प्रोसीजर करते हैं। तो अराउंड 37-38 आवर्स पे हम बुलाते हैं पेशेंट को, पहले चेक करते हैं कि वो अंडा ब्रेक हो गया है, वो जो अंडे का बीज ब्रेक हो गया है, दैट मींस ओव्यूलेशन हैज टेकन प्लेस, एंड देन वी आस्क द हस्बैंड टू गिव द स्पर्म इन अ कप, लिक्विफाई द स्पर्म। वहाँ पे फिर हम प्रोसेस डालते हैं, हम मीडिया डालते हैं, स्पेशल मेडिसिन डालते हैं, वो उसको वॉशिंग मीडिया बोलते हैं। डेड स्पर्म्स, इमोटाइल, अनहेल्दी स्पर्म्स सेपरेट हो जाते हैं, हेल्दीएस्ट बेस्ट स्विमर्स जो बोलते हैं ऊपर आ जाते हैं, एंड वो ही जो लेयर है जहाँ पे बेस्ट स्विमिंग स्पर्म्स होते हैं उसको हम छोटी सी ट्यूब में लेते हैं एंड वो ट्यूब को हम वजाइना थैली जो यूट्रस का जो मुंह होता है उसको बाईपास करके डायरेक्टली into the it's intra-uterine insemination, यूट्रस में डाल देते हैं। So advantages की you are timing it during the time you have ovulated, you are allowing more sperms to reach the egg, because natural intercourse जब करते हैं vagina is acidic, vagina में ही 50% up to 40 to 50% of the sperms get destroyed in the vagina, right? फिर बाकी कुछ पहुंचते हैं भी कम पहुंचेंगे, so you are avoiding that, and the sperms also have to travel long distance from the vagina to the egg. यहाँ पे यूट्रस को खाली यूट्रस से ट्यूब क्रॉस करके ही एग को जाना है, तो मोर स्पर्म्स आर अवेलेबल, सो योर चांसेस आर इंक्रीज्ड। सो बट अ प्रीरेक्विजिट फॉर IUI शुड बी दैट द ट्यूब्स शुड बी ओपन। अगर फैलोपियन ट्यूब्स जो नली होती है वो ब्लॉक्ड होगी तो फिर IUI को कुछ मीनिंग नहीं है, क्योंकि फिर वो एग और स्पर्म मिल ही नहीं पाएंगे। सो आइडियली नली की टेस्ट करनी चाहिए आइडियली। ओके सो IUI ये होता है, हम कई बार पेशेंट अगर उनकी एक रिजर्व अच्छी है, हस्बैंड के स्पर्म्स भी एटलीस्ट 10 मिलियन पर ml होना चाहिए फॉर IUI टू वर्क, ये सब अच्छा है एंड वी हैव ट्राइड नेचुरली, देन यू कैन ऑफर IUI। 3 से ज़्यादा साइकिल्स वी डू नॉट रिकमेंड, why? Because success rate of IUI is also just 10 to 15%, and in जो भी couples IUI से pregnant हुए थे, 90% of the couples who have got pregnant with IUI they conceive in the first 3 cycles. अगर 3 cycles have failed, no, then you are by doing IUI is not, there's no meaning. That means you have to look at something else now. You know, is the egg that is coming out, is it there? Is it good quality? You know, is the sperm being able to penetrate inside the egg? Is it being able to fertilize the egg? You know, is the embryo growing particularly well? Uterus की lining अच्छी बन रही है embryo डालने में? ये सब फिर ज़्यादा आंसर्स जानने के लिए then you have to go to the next step, which is IVF. Got it. Okay. IVF क्या है? IVF में same thing, lady, woman's second day or the third day of the period, you call them and you have to scan, you have to do a sonography, internal sonography करते हैं before we start, and we make sure कि अंडे के बीज सब छोटे होने चाहिए, कोई सिस्ट बड़ा गांठ नहीं होना चाहिए, और ये सब अगर क्लियर होता है तो हम इंजेक्शंस देते हैं। जैसे मैंने आपको पहले बोला, इंजेक्शन हार्मोन के इंजेक्शन होते हैं, डोज थोड़े हाई होते हैं, क्योंकि अभी हम सब कंट्रोल में रखने वाले हैं। सो वी वांट एज मेनी एग्स इन दैट साइकिल टू ग्रो, टू मेक इट वर्थवाइल, to have a better chance of success. Right. So we give a higher dose to make almost as many follicles to grow, के अंडे के बीज को grow करने के लिए 5 दिन इंजेक्शन देते हैं, 6ठे दिन पे वापस से बुलाते हैं देखने के लिए कि मेरे इंजेक्शंस का रिस्पॉन्स अच्छा है कि नहीं। अगर रिस्पॉन्स है तो वी कंटिन्यू, वी ऐड अनदर इंजेक्शन समटाइम्स टू, नहीं तो वो कभी कभी ब्रेक हो जाते हैं फॉलिकल्स, तो उसको ब्रेक नहीं होने के लिए हम दूसरा इंजेक्शन देते हैं। एंड जब भी मैक्सिमम नंबर ऑफ फॉलिकल्स 18-20 मिलीमीटर को हो जाते हैं, देन वी डू एग कलेक्शन, प्रोसीजर ऑफ एग कलेक्शन। एनेस्थीसिया के अंडर किया जाता है, पेशेंट इज कंफर्टेबल, यू आर कंफर्टेबल। इंटरनल स्कैन से हम वजाइनली, ट्रांस वजाइनल स्कैन जो बोलते हैं उससे एंटर करते हैं, एंड सोनोग्राफिकली हम फॉलिकल जो होता है अंडे का बीज को हम एक लंबी सी नीडल से उसको पंक्चर करते हैं, और उसके अंदर का पानी हम बाहर खींचते हैं, और जो भी पानी है वो फिर हमारी एम्ब्रियोलॉजी लैब में जाता है, और एम्ब्रियोलॉजिस्ट जो होता है वो वहाँ पे बैठा होता है, माइक्रोस्कोप के अंदर देखता है पानी में अंडे हैं कितने हैं, फिर वो अंडे को 2 घंटे के लिए इंक्यूबेशन के लिए रखते हैं, 2-3 घंटे, देन वी रिमूव इट अगेन, एंड क्योंकि जो पहले जो अंडे आते हैं उसके सराउंडिंग सेल्स भी होते हैं,
राइट,
तुरंत हम सेल्स को नहीं निकालते हैं, ना तो अंडे शॉक में जाते हैं, 2-3 घंटे के बाद निकालते हैं, और तब पता चलता है कि कैसे हैं अंडे, मैच्योर है, इमेच्योर है, कितनी मैच्योरिटी है, मैच्योर है। फिर वो दिन हस्बैंड को स्पर्म्स देने होते हैं, सीमेन देना होता है, एंड वी इंडिविजुअली टेक द बेस्ट लुकिंग स्पर्म, वी लिटरली टेक द बेस्ट लुकिंग स्पर्म, you know, immobilize the tail, take the sperm in a small needle, and we inject it inside the egg, inside each egg. This is called ICSI. Okay, this is intracytoplasmic sperm injection. It's a form of IVF. If you see conventional IVF अलग होता है, conventional IVF में हम अंडे लेते हैं, sperms को wash करके फिर छोड़ देते हैं, and they still have to naturally conceive. But very honestly, nowadays most of the labs are doing ICSI.
Okay.
It does not need to be done for everyone. It also has to be indicated. But क्या होता है कि ये अब्रॉड में हम कन्वेंशनल IVF करते हैं, फिर अगर साइकिल सपोजिंग इनफर्टिलिटी का कॉज है कि स्पर्म फर्टिलाइज ही नहीं कर रहा है एग को, और आपने सपोजिंग IVF किया और यही हुआ, और फिर आप क्या बोलोगे पेशेंट को, बोलोगे अरे फर्टिलाइज ही नहीं हुए, and this is all self-funded cycles. Abroad we used to do IVF, conventional IVF in UK. फिर अगर एक साइकिल फेल होता तो हम नेक्स्ट साइकिल में ICSI करते थे, बट क्योंकि गवर्नमेंट फंड करता था, यहाँ पे don't take a chance.
Tell me the process के एक पेशेंट या एक कपल आता है आपके पास कि okay they are not what you call getting pregnant.
Yeah.
So what are the stages and how do the treatments work? Like the first step is basically what, just general tests like that. Can you just work me up?
Yeah.
Like you, because आपने explain किया IUI and IVF.
Yeah.
So then I realized that maybe giving them an idea कि what are the steps.
Yeah.
Would be a great thing.
First is take a detailed history. पेशेंट की हिस्ट्री सुनो, स्टोरी होती है, कब से ट्राई कर रहे हैं, उम्र कितनी है दोनों की, पीरियड्स के बारे में पूछो, मेडिकल कंडीशंस जो भी है सब कुछ डिटेल में पूछो, पहले प्रेगनेंसीज हुए हैं, मिसकैरेजेस हुए हैं, क्या हुआ है, ये सब डिटेल में जानो। देन एग्जामिन द पेशेंट, हाइट, वेट, BMI देखो, ब्लड प्रेशर देखो, समटाइम यू विल बी सरप्राइज्ड दे आर हैविंग ब्लड प्रेशर आल्सो। हेड टू टो आइडियली एग्जामिनेशन करो, ब्रेस्ट एग्जामिनेशन करो, यू नो ऑल ऑफ दैट, एंड मेल्स का भी आइडियली हिस्ट्री एंड एग्जामिनेशन करना चाहिए। ओके, देन यू डू बेसिक टेस्ट्स, एंड बेसिक टेस्ट में होता है यू नो आप हीमोग्लोबिन देखो, शुगर्स देखो, थायराइड देखो, हार्मोन के टेस्ट में थायराइड है, प्रोलैक्टिन है, बेसिक टेस्ट करो, एग के रिजर्व की टेस्ट होती है वो करो, सोनोग्राफी करो, देखो कितने अंडे दिख रहे हैं, वो भी ड्यूरिंग पीरियड्स आइडियली करने चाहिए, सो दैट यू आर अवेयर कि कितना काउंट है।
Right.
And you know, HIV, hepatitis B, HCV and VDRL, these are viral markers which the government and ICMR has made it compulsory. Two other important tests that we should do is thalassemia, and this I'm telling you everyone that whoever wants to conceive or whoever has conceived in early pregnancy, if they've come to a doctor, please do thalassemia test.
Why?
HB electrophoresis. Thalassemia एक condition होती है, there are two types, thalassemia minor, छोटी thalassemia और बड़ी thalassemia, thalassemia major. It is not that uncommon in India, especially Western India, जो belt है, Western Gujarat, Rajasthan, Punjab, and now in Pakistan, Sindh area. These and you know it's found in Khoja, Bori Muslim a bit more. This thalassemia gene is found, thalassemia minor. They will be normal adults. आपका hemoglobin थोड़ा borderline low होगा. मगर if they are married also to a thalassemia minor, husband wife दोनों thalassemia minor अगर होते हैं, तो बेबी का 1 in 4 चांस होता है बेबी विल हैव थैलेसीमिया मेजर, एंड वो those babies cannot survive beyond the age of 5 or 6 years. They will not form hemoglobin, so उनको blood transfusion weekly देना पड़ता है. Because of constant blood transfusion, imagine the suffering the child goes through, the parents go through, and iron overload से body multiple organ failure हो जाता है and those babies die. It's a simple blood test, you have to get it done. And if the patient is a carrier for thalassemia, test the husband. अगर husband normal है, don't worry.
Okay.
अगर husband भी thalassemia minor है, then you have to counsel this. And there is a 1 in 4 chance ये है. So some people can take. Then still 3 out of 4 the babies will be still fine. Okay, if I be very technical, 2 out of those 4 carrier ही हो गए उनके जैसे, and 1 out of 4 एकदम ही normal हो गए. But वो 25% chance लेना है आपको. So वो फिर उनका choice है. Some people say या ले लेते हैं. आप प्रेगनेंसी में भी टेस्ट कर सकते हैं. जब भी चौथा महीना होता है, प्रेगनेंसी में नीडल पानी लेकर टेस्ट कर सकते हैं कि बेबी में है या नहीं है. बेबी के सराउंडिंग जो पानी होता है उसमें इसके सेल्स होते हैं. So you can test it कि whether the baby is there. But then if it does have, then most people opt for termination. वो भी एक प्रोसीजर हो जाता है. अगर उतना नहीं करना है तो IVF comes at play there, where you can make the embryos at the embryo level, test the embryos, and those embryos which don't have the thalassemia major gene, you implant those. So इतना वो pregnancy and termination of pregnancy की trauma they don't have to go through. So see how beautiful technology is. So yeah, that test is very important. HB electrophoresis or thalassemia.
Got it. Right. So the first process is obviously they'll consult. Then you'll probably prescribe some allopathy, which kind of just, and with of course after tests. So then we'll prescribe allopathy so that they still try naturally.
Yes.
And if that does not work, then you move to IUI.
Yeah.
And then the final is IVF.
Yes. So usually this is the flow. Again, case to case बहुत फर्क पड़ता है, बहुत change होता है. So this is an ideal scenario where it's a young couple not trying for too long, and if their test results are all normal, ovarian reserve अच्छा है, so we know we have time. Then if everything is normal, then you say that okay, you know what, try for 3 months. कई बार हिस्ट्री में पता चलेगा कि टाइमिंग ही बराबर नहीं रख रहे, तो आप सिंपल करो फॉलिकुलर स्टडी प्लस प्लान्ड रिलेशन. आप उनके ट्रैक कर सकते हैं ओव्यूलेशन. जब भी ओव्यूलेशन के अराउंड टाइम होने वाला है, यू टेल देम टू कीप रिलेशंस.
राइट.
ओके, अगर 3 साइकिल इससे ये करने के बावजूद भी प्रेगनेंसी नहीं होती है, then you counsel them कि okay, now let's start evaluating a bit further. हमने बेसिक टेस्ट किए, आपने ट्राई किया है, सीमेन स्पर्म्स अच्छे हैं, आपके ओव्यूलेशन का टाइम ने आपने टाइमिंग भी बराबर रखा है, फिर भी प्रेगनेंसी नहीं हुआ है, तो लॉजिकली नेक्स्ट स्टेप है कि चलो ट्यूब की जरा टेस्ट करें. ओके, देन यू टेस्ट द ट्यूब. It's a little bit of an invasive test. There are 2-3 ways of doing it. I'll not go into too much detail, but just the long and short of it is that you have to pass a tube inside, pass a dye from down, and see whether that dye or that fluid or liquid that you're injecting from down is coming from both tubes or not.
Right.
दोनों tubes से आ रहे हैं, that means tubes खुली है.
So the same thing like you mentioned, the passage has to be there.
Passage is to be open.
Right.
अगर उसमें blockage है तो again you have to address it.
Right.
दोनों tubes अगर blocked है, then you can't do IUI. Then you have to consider, you give them the option. आपको ट्यूब्स खोलने की ट्राई करनी है या फिर आप डायरेक्ट IVF के लिए जाओ. क्योंकि अगर ट्यूब्स अनहेल्दी है तो वो खोलने की भी ट्राई करोगे तो भी वो अनहेल्दी ही रहेगा, तो फिर आप IVF के लिए जाओ.
Got it.
So there is no hard and fast कि यही फ्लो करना है. अभी सपोजिंग कपल आया और you know supposing the sperm count is very low, less than 5 million per ml, आप again lifestyle modifications, medicines होते हैं, उसको 3 महीने का ट्रीटमेंट आप दे सकते हैं. And many times it comes up, but अगर नहीं आया, उतना का उतना ही रहा sperm, then sometimes you have to resort to IVF. Or if the egg reserve is very low, कि हमको टाइम ही नहीं है, reserve बहुत कम है egg की reserve, तो sometimes you have to resort to IVF earlier rather than later.
Right.
But yes, generally flow is that if everything is good, normal, natural try karo, semi-natural by follicular study and planned relation, not work then IUI up to 2 to 3 cycles, and if not then IVF.
Well, you mentioned like you use the word cycle quite often.
Yes.
What is a cycle? Can you explain
what
a cycle is?
A cycle is basically a menstrual cycle.
Okay.
Okay. Menstrual cycle is a cycle. Everything revolves around that cycle, right? From the eggs being the smallest till it grows. The first phase, what is called as the follicular phase, where the follicle is growing from 2 to 3 millimeter size to 18 to 20, 22 millimeter size, where it becomes mature. And then the egg ruptures or breaks out, comes in the tube. And now the next phase is called as the luteal phase. So these 2 phases form a cycle.
Okay.
Usually averaging around 28 days in an
Okay.
can range anything between 24 to 35 days. It's normal. So this is a
Right.
cycle, menstrual cycle.
And ये cycle में then what does a fertility expert basically do in terms of like days so that the chances or the success rate of fertility is higher?
Yeah. So basically, again, it comes to timing. Important things that a fertility expert has to see if you're tracking the cycle is the egg growing properly, nicely. Along with the egg growing is the lining. Uterus की lining भी बराबर से grow होनी चाहिए, thick होनी चाहिए. Around the time of ovulation करीबन 7 millimeter की होनी चाहिए.
Right.
So that's a good thickness. So that embryo form होता है तो implantation के chances ज़्यादा होते हैं. So these are the few things that the clinician has to see. And
Right.
अगर lining थोड़ी lag होती है, let's say अंडा break होने वाला है but lining पतली है, तो कभी-कभी medicines दिए जाते हैं lining को थोड़ी thick करने में.
Right.
After the anda has come out, they've kept relations, you tell them that okay, you can even give a little bit of support to the supposing pregnancy हो रही है तो थोड़ा added support दे सकते हैं. आप progesterone hormone होता है, low dose दे सकते हैं, just to that it supports the pregnancy, makes the lining a bit more conducive.
Right.
Okay, you don't have to give very high dose, but more normal dose. Make sure that the woman is taking folic acid. So another thing when they're starting also, folic acid should be taken because first 3 months में folic acid is very important. When they get pregnant, around the time of pregnancy, in the beginning, folic acid is very important for nerve and spinal cord formation, or what we call as neural tube.
Right.
So these are the few vitamins and minerals and and tablets that we can give to support pregnancy and a healthy one.
Right. You mentioned earlier like I noted that you mentioned couple of times that semen and sperms, are they different?
Yes. This is another, people keep thinking semen and sperm is the same.
Yes, I mean I had no clue. I realized it when you were talking.
Semen is the fluid, the whole conglomerate that is coming out, the whole fluid that is coming out is semen. Semen में होता है sperms. So semen will have a liquid portion. It will have cells also. Epithelial cells होते हैं, pus cells भी हो सकते हैं कभी-कभी, and sperms होता है. So sperm is a part of the semen. Semen is like the it's a fluid that comes out.
Got it. Okay. I have an interesting thought is actually. These days, I think काफी सारे couples होते हैं. They always like keep discussing, especially that whether one child or two children. Is it better? Because मतलब normally हम लोग कैसे myth होती है. What is the conversation is कि okay 2 बच्चे होंगे. Parents also say that अगर 2 बच्चे होंगे तो then साथ में बड़े हो जाते हैं and all that. What is your take as a doctor on that?
I personally have 2 kids.
Yeah, I know.
My wife just gave birth on 11th of October. Right. See, it's a very personal question. It all depends on the needs and what the parents desire. There's no wrong or right. So, most couples, as you earlier we mentioned, are going for a single child. It's a single child family, like one child, one and done. I have a colleague who actually, I just remembered, he says, I'm one and done, so one and done. But, there's a lot of I would not say misconception, there's a belief that, especially those who are a little bit older couples. I've got a couple who is the father is almost 48 years, 49, and the wife is 40. And they just recently, luckily, conceived with IVF. They had 2 embryos. I put one, got pregnant, and she got her baby girl. Just in July they got, and they've come back just for a follow-up, and they're already thinking. The husband is thinking. He came to me and like, doctor, abhi next kabhi kya transfer kariye Gujarati mein. And I see the wife. The wife was struggling. See, postpartum, people don't talk about all these things. IVF करने से खाली success rate is not कि आप 2 लाइन आया या बेबी दे दिया, नहीं. आप is the family, is the mother happy? Is she undergoing a decent puparium? हम उसको puparium बोलते हैं, post pregnancy stage. Is she in a good state of mind and all? And she was absolutely not in a good state of mind. I said, listen, embryo इधर ही है, किधर नहीं रहने वाला है, but don't rush. I said, why do you want to? Does she want to? And she was like, no doctor, I don't want. His thought process was, हाँ अभी हम बूढ़े हो रहे हैं, you know, आप सोचो ना सर, आप 17, मेरे ये बच्ची 17-18 years की होगी, फिर हम almost will be closer to 80, you know, 80. So I said, then that's not good enough a reason to rush into having a second, like, you know. So then she will have a companion. अभी के जो बच्चे हैं, they are so independent. Trust me, and with social media, with good, you know, people are getting a bit more social, easy. You don't have to always go for, you know, more than one kid, unless you want. And if you want, then you have to be ready from the beginning. And you have to see both. You have to see the mother. You have to ask the patient. She is going to carry. She is going through that embryo transfer and 3 months of those bloody hormones and all of that. It's not easy. And then post pregnancy, sleepless nights again. तो ये जो है एक बड़ा सा ये रीजन होता है कि नहीं हम थोड़े से ओल्ड हो रहे हैं तो इसके कंपेनियनशिप के लिए करें.
बिकॉज ये काफी मतलब मैंने सुना भी है लोगों से काफी सारे कि अरे 2 बच्चे होते तो क्या साथ साथ में फिर बड़े भी हो जाते हैं. दे हैव ईच अदर एज वेल व्हेन वी आर नॉट देयर. ये बहुत एक कॉमन एंड आई एम लाइक no, I mean they will have us, they will have what you call parents,
you have your friends. You have, yeah. Right. See, we always wanted to, you know. Now I'm just talking very this thing, but it's even if we had one, we would have been fine, you know. It's just I guess give that example. हाँ होता है, एडवांटेज होता है, उसमें भी एज गैप कम होता है तो ऑलवेज बेटर होता है साथ में, बट उसके साथ साथ डिफिकल्टीज भी उतनी ही होती है जो लोग नहीं देखते हैं. आपके फर्स्ट 10-12 years डिफिकल्टी में ही जाते हैं.
Right, that's true. And also I think kids are expensive these days.
They are very expensive.
I mean I think a lot of times, which is I was having a discussion or a conversation with one of my friends.
Yeah.
And I mean he told me, I just asked, like they also actually were blessed with a baby boy sometime back, 1 year back. And I said, okay, you know what, are you guys planning a second one? Because he asked me the same thing. He's like, well, what are you guys thinking and stuff like that. So I said, I mean, like, I don't know, I'm not sure, this and that. And I asked him, I was like, okay, what about you? He's like, yeah, it's fine and all of that is good. He said, but yeah, dude, you know what? Kids are freaking expensive. I'm like, yeah, of course they are.
Yeah.
And the funniest thing is, and there's one line that he told me which really got stuck on me, is that, you know, no matter how much you do for your child, it's never going to be enough.
True.
Yeah, he's like, you know what, you will be extremely successful, you will set up a good life for them, even what you call today, you start doing it so they have good education, they have a good life, but at some point of time, 1-2 years later, you will still feel, am I doing enough?
Yeah.
Is this enough?
Yeah.
Because by the time they would have grown up, like I was reading an article a little while back, maybe 6 months back, where I read that for a child who's probably like 1 or 2 year old today, and by the time they end up doing their MBAs, it's going to be anywhere between 3 to 4 crores.
Yes. Yeah.
And that's an insane amount.
That.
Yeah. I mean, that's an insane amount of money.
Yeah.
You know?
So it takes a lot of effort. And it's not only the material aspect. You have to give quality time. You have to give your all 100%. Being a parent involved. You know, nowadays you're seeing that, okay, you know, bachche kar diye, and then nannies and everyone are like, majority of the time they're just with the nannies. It is good. Nannies are, there's nothing against them, and they are excellent also, but somewhere you will have to devote time.
Right.
And some sacrifices you have to make. So it is expensive. It can be physically, mentally draining. You know, there are so many times where a few things that you wanted to do, and then, you know, kind of now, like let's say you wanted to have a new venture, you wanted to go here, there, and then things you have to take a step back.
Yeah.
So there's no wrong or right. It does have its advantages. It does have its disadvantages. You have to prioritize what is your priority. Right. What would you rate above, like what is more important for you?
Right.
And then take the decision and then go. Then don't regret.
So doctor, are you also seeing a lot of patients these days who've या तो उनको 1 या 2 बच्चे हो गए हैं possibly, and they're coming in for vasectomies now?
Yeah. So I'll be very honest. People coming for vasectomies are very few. And again, I just recently I was talking to a colleague of mine that the same person who said one and done, and he has so boldly gone and done his vasectomy, and that's brilliant. I think So still, I feel people coming forward for a vasectomy is still low in our country. Again, I don't know why. It's there may be like some misconception that vasectomy kiya to you may not be able to have sex or your libido will go down. Misconception. There is no relation with a vasectomy where your vasectomy is a vas deferens को आप cut कर रहे हो, ligate कर रहे हो, separate ताकि sperms ना आ सके.
Right.
The main hormone for increased libido is the testosterone, which is going to be produced in your testes. So, it's a misconception.
But tell me this then, if you get a vasectomy done, then does a male still orgasm? Or they don't?
So, they do orgasm.
Okay.
Yeah.
So, what is the difference?
There's no difference. So, the thing is that the sperms will not come. But as I said, semen
will
different.
Come.
Semen to aayega. And the orgasm is when the semen is coming out. Orgasm is a feeling. When it does not need sperm to come out. It's when the semen is coming out, that's when you orgasm.
And how does it work in women?
Orgasm? No, sorry. Sorry about that.
No, it's absolutely. I mean, in terms of the vasectomy.
So as you like it, sorry, that was really innocent. I mean, I did not mean it. I didn't want to be smart or anything. In vasectomy, you cut or ligate the vas deferens. Right. In female, you tie the tubes. ट्यूब्स जो होती है ना उसको हम टाई करते हैं. देयर आर मेनी मेथड्स. क्लिप डाल सकते हैं आप, टाई कर सकते हैं, कट कर सकते हैं ताकि एग एंड स्पर्म डोंट hit each other. Enter.
Interesting. So we were talking about like postpartum, and that kind of triggered a question in the head about the mental stress that people go through, especially women. I mean, forget about men. I think let's focus on women.
Yeah.
Especially.
Yeah.
In cases like miscarriages, do you see a lot of women coming in today's day and age, like patients, aapko bhi, where they have gone through miscarriages?
Yeah. So miscarriage rates up to 15% of the pregnancies miscarry. 10 to 15% is a miscarriage rate. Which is clinically diagnosed. Subclinically, and I'll tell you what that means. Subclinically means कई बार तो period आ जाता है and actually they'll never know that it was actually a miscarriage. अगर वो गिना जाता है तो 20-25% होता है. So almost 15% of the pregnancies miscarry, and we are seeing again a little bit of an increased trend because as the age increases, chance of miscarriage also increase because again it goes down to egg quality, embryo quality. If the embryo is not genetically healthy, chance of miscarriages are higher.
Right.
Which is the most common cause of a first trimester. Early miscarriage का most common cause होता है embryo ही genetically healthy नहीं होता है.
Right.
और उसका आप या मैं कुछ नहीं कर सकते हैं. Okay. Then comes other causes like again, conditions like diabetes, uncontrolled thyroid, obesity, factors like lifestyle, like smoking, excessive alcohol drinking can cause miscarriages. Second trimester, like after the third month में अगर uterus weak, the uterus का जो मुंह होता है, cervix जो बोलते हैं, वो अगर weak होता है या short होता है because of repeated procedures in the past, then it can just give way and the baby can miscarry. Many reasons are there. Or infection also can cause miscarriages. So, but 50% of the time you will not know the cause. It may remain unknown. But these conditions you have to rule out. There are certain conditions, there are antibodies in the women that cause miscarriage by stopping the blood flow. And usually they have recurrent miscarriages in that. Right. So when a woman has undergone, even if they've undergone one miscarriage, you can do these tests. But if you go by the book, if they've had 2 consecutive miscarriages, then you start investigating and doing these antibodies also if they're present. Okay. Now, ideally, we can start from the first miscarriage. So why to wait till the second miscarriage? Because अगर ये positive आता है, the treatment होती है उसकी. You give blood thinning injections to keep the blood flowing.
So this percentage जो है वो miscarriage का almost up to 25%. Is that inclusive of all the treatments that fertility में जो होते हैं वो?
Yeah, the miscarriage rates don't increase. It's the same. It's either whether you conceive. So it's not 25%. When I would say clinically diagnosed miscarriage, or let's be very simple in simple terms, 15% miscarry of the pregnancy, which is the same for natural conception or IVF. Same ही रहता है.
So अगर ये केस में अगर ये treatment जो रहेंगे हम लेते हैं या whether it's IUI, IVF या उसके पहले के, what is the overall success rate of those treatments?
Yeah. So if you do IUI, as I said, 10 to 15% is a success rate. Over a period of 3 cycles, the cumulative success rate will go up to 22%. ज़्यादा नहीं. IVF का average success rate is 40-45%. And when I say success rate, it means live birth rate, not 2 lines on the pregnancy test and showing it as success. हाथ में बच्चा है, that's the time. So in fact, in the OPD, this last month, we had a very good month. Out of 5 embryo transfers, 4 came positive. 4 patients आए, मिठाई लेकर, 3 out of them. And I said, no, don't rejoice yet. We have a long way to go. आप तभी खुशी मनाओ जब बेबी हाथ में आए. No gifts, nothing. So live birth rate is the marker we are looking at. So that is 40-45%. If supposing you are testing the embryo, like let's say they've had a few miscarriages in the past, or they are older, like 40 and up, or they've had an abnormal baby in the past, then we can offer testing of the embryo so that to see which are genetically normal, उसको ही हम डालो. तो then आपका live birth rate, success rate थोड़ा ज़्यादा हो जाता है.
Right.
50-55% तक होता है. 100% कुछ नहीं होता है.
This postpartum भी जो आपने बोला, that was very interesting. We did a podcast actually with one of these fitness experts who actually specializes in postpartum fitness.
Oh, wow.
Or at least women who actually come back to their original body and shape once they've delivered, and that was such an eye-opener.
Oh, lovely.
Because that postpartum, I mean, I had no clue. I think for men anyways, postpartum is like a very, very very different and very, I think an unknown area completely.
It is.
Yeah. And जब मैंने मतलब वो बातें की, and then I realized how difficult and what sort of a scenario that women go through. That was...
So if you, I mean, I can speak about it a little bit because I've seen in UK, 7 out of 10 women undergo postpartum blues. Out of those, 40% have postpartum depression needing medication. And out of them, 2 to 5% have gone to a severe level of psychosis also. It's rare, but it is. So, abroad, it is seen a bit more because of nuclear family, family being away. Here, it's a little less because we have familial support, but it is increasing in trend.
Right.
And postpartum, it should be addressed. People just say, baby aa gaya, wow. We make it a point to keep asking the mother, are you all right? Are you sleeping well? Are you eating well? Most of the time, no, they will not realize. There are some telltale signs, red flag signs only that will tell you. Like, for example, getting unnecessarily worried, asking questions that are, like just unnecessarily worried about few things, lack of sleep, feeling tired all the time, not eating well. And they may feel that, it's physical, but it's actually more at a mental level. So it's very important to address that.
Right.
Yeah.
But are you are you also seeing patients who after the delivery go through that range of emotions as well?
Oh, yes.
So what is the treatment that you then suggest?
Treatment first is, it starts with your gynac, like that's us, whoever's delivered, the obstetrician, not a gynac, obstetrician should be able to pick it up. So be empathetic, hear them out. Don't just treat them like, oh, delivery ho gaya, scar dekh liya, or whatever, everything's healed, iron calcium le lo, jao. If you see the patient wants to talk, and the more they want to talk, that means this is a safe space, they trust you.
Right.
And then you kind of can realize that, okay, you can triage them, that, okay, if they need more help, therapists hai. There are therapists who can talk. And if still therapy is not working, there are certain medications also. Psychiatrists are there. We have such good psychiatrists and such good medications that are safe even if they're breastfeeding. Because see, in UK there was a case where while I was there, one patient committed suicide, just 2 months into delivery. And then we realized that had she just, had someone, and then, they do a cause and effect analysis, they go do the root cause, what could they have done? That's how much they work, And they realized that she kept going to the GP saying, I've got headaches, I've got this. Didn't get picked up, that why is this? Why she keep on coming? Had this been picked up or prodded a bit more, she would have opened up. They would have referred her to like specialists. She would have got treatment. She wouldn't have ended her life. Every life is important.
Of course, and I think the amount of mental stress that the doctors also go through when they hear some stuff like this, it can make or break you.
Thank you for touching upon that, because we also have worked a lot, worked so hard, and then nowadays you see these news, what has happened in Bengal, and it hurts, it hurts, it angers us. इतना मेहनत करके भी ऐसे treatment मिलता है. So yeah, it's a tough job, and yeah, that's how it is. Someone has to do it.
So smoking or alcohol, which is the bigger evil when it comes to fertility?
100% smoking. Smoking is always a bigger evil, because alcohol, so NICE is which is a National Institute of Clinical Excellence in UK. They do a lot of research and then they come up with evidence-based protocols and guidelines. They found that alcohol is allowed when you're trying for a pregnancy, and there is an allowance. Like males can have up to 3 to 4 drinks, which includes like 30 ml drinks in a week, or 3 to 4 pints of beer in a week. Females can have up to 1 to 2, maximum 2 drinks in a week. Because liver processes alcohol. Liver is an organ which will process alcohol, break it down. Smoking, there is no organ that can process the tar and nicotine and all that. And once it's in your blood, the carboxyhemoglobin, which is the carbon monoxide, it's stuck to it and it goes and it affects the sperm and egg. So smoking is an absolute no. Even vaping is an absolute no, which is nowadays we are seeing. Unfortunately, many times you have to, those who are smokers, a packet a day, you can't just, it's tough for them to quit. Cold turkey is very difficult. So sometimes you have to tell them reduce to like, much less, and then ideally stop, but they can't. Then sometimes I do tell them, okay, fine, find an alternative to tide it over, vape,
right.
And
gradually,
then eventually you have to stop.
Right.
So smoking is the bigger evil.
I understand.
Yeah.
Right. You spoke about, the mental stress that we were talking about. एक आदमी का role इस situation में क्या होता है when you know that your partner is going through such things?
तो आदमी का role बहुत important होता है. उनका, all he has to do is just be present. Many times I see कि couples आते हैं पहले consultation के लिए, फिर कई बार नहीं आते हैं husbands. ठीक है, हम busy है, ये है. But if you are present during the cycle, especially during a little bit like IVF and IUI के time पे, जहाँ पे थोड़ा भी हम एक step higher गए हैं, तो तभी already patients are a little bit, the women are a little high strung, stressed. तो आप present रहो. अगर आप नहीं आ सकते तो एटलीस्ट घर पे be patient, hear what the wife is saying, just be there, just be emotionally supportive, not just financially supportive. And understand that the hormone treatment and all of that temporarily can affect the woman. So you have to again be patient, not when she is reacting, don't add to, don't react and then cause a fight, just kind of take a step back, understand that she's going through the treatment. It's very stressful. it's not easy going through all these hormones and cycles after cycles, and then नहीं होता है तो उसका disappointment होता भी है, then she has to carry that baby for 9 months. तो वो हमारे लिए थोड़ा easy रहता है, तो हमको थोड़ा सा empathetic रहना पड़ता है. That's the only thing.
Great. Thank you so much, Dr. Anand, for this really interesting and fun chat. I hope it was fun for you as well.
It was fun. I hope it's useful, and I hope it benefits people.
Thank you so much. Thanks a lot.
Very nice meeting you. Nice. Thank you for having me.